Have you ever heard someone say milk causes cancer? Or someone else say drink more milk and also take calcium tablets to prevent cancer? So, which one is true? Hello, everyone. Welcome back to my channel. I'm Dr. PriyaRavi, PhD. It's been a while, but I'm happy to be back with another evidence based health video. Can milk, calcium, and vitamin D reduce cancer risk? So, according to the American Cancer Society, research suggests that diets rich in calcium and dairy foods may help reduce the risk of colorectal, that is, large intestine cancer. This evidence is considered fairly strong. Some studies also suggest that calcium may help reduce breast cancer risk, but the evidence is still limited. Some studies found that people consuming around 400 grams of dairy per day, that is roughly 2 cups of milk, or the equivalent amount of dairy foods, had about an 11% higher relative risk of prostate cancer. So please understand what this means. This does not mean that drinking 2 cups of milk causes prostate cancer. It simply means researchers observed a small increase in relative risk in people with very high long term dairy intake. Similarly, people consuming more than 2000 milligrams of calcium every day, especially through high dose calcium supplements over many years, were found to have a higher risk of advanced prostate cancer. Again, this does not mean that stop drinking milk. The scientific message is moderation, not fear. What does the American Cancer Society recommend? Because dairy foods may reduce the risk of some cancers, while very high intake may slightly increase the risk of others, the American Cancer Society does not recommend either increasing or avoiding dairy foods specifically for cancer prevention. Instead, the goal is to meet your daily calcium requirement through a balanced diet. So, now comes the important question: how much calcium do we need in a day? The recommended dietary allowance, the RDA for most adults, is 1000 to 1200 milligrams of calcium per day. Does calcium come only from milk? Absolutely not. Many healthy foods are rich in calcium. These include milk, curd or yogurt, paneer, ragi, sesame seeds, tofu, almonds, green leafy vegetables like amaranthus and drumstick leaves. So, getting calcium from a variety of food is a healthy approach. If you already get enough calcium through your diet, avoid taking high dose calcium supplements unless your doctor advises you to. Did you know even if you're eating enough calcium, your body may not be able to use it properly? Why? Because calcium and vitamin D work as a team. Think of calcium as the bricks needed to build strong bones, and vitamin D is the worker who helps place those bricks where they are needed. Without enough vitamin D, your body absorbs much less calcium from the food you eat. Over time, this can weaken your bones and increase the risk of fractures. Then, what about vitamin D? Vitamin D is mainly produced in our body through sunlight exposure. It is essential for healthy bones, immunity, muscles, and overall health. Studying whether vitamin D helps reduce cancer risk, especially colorectal cancer. Some studies showed possible benefits. However, large clinical trials have not proven that vitamin D alone can prevent cancer, and most adults need around 600 to 800 IU, that is international units of vitamin D per day. Although people with deficiency may require supplements prescribed by the doctor, stay physically active, maintain a healthy weight, eat plenty of fruits and vegetables, whole grains, and pulses. Remember, no single food causes cancer overnight, and no single food or vitamin can completely prevent cancer. So, cancer prevention is about your overall lifestyle, not one magic food. If you found this video helpful, please like, share, and subscribe for more evidence based health and cancer awareness videos.